As people age, the skin on their face undergoes significant changes. It becomes thinner, less elastic, and more delicate, making it more vulnerable to damage, infections, and dryness. This makes daily facial cleansing especially important for seniors, particularly those over 70. The face is constantly exposed to environmental pollutants such as dust, smoke, and bacteria, which accumulate on the skin throughout the day. Additionally, natural oils produced by the skin mix with sweat, dead skin cells, and other impurities. If these are not removed regularly, they can clog pores, leading to irritation, acne, or infections. In elderly individuals, the skin's natural ability to repair itself slows down, so neglecting facial hygiene can lead to more severe problems. Daily washing helps remove these impurities and excess oils, keeping the skin clean and healthy. It also stimulates blood circulation, which improves skin tone and promotes a healthy complexion. For seniors who might have reduced mobility or limited dexterity, it is important to develop a simple yet effective facial cleansing routine that they can easily manage. Choosing the right cleanser is crucial. Many elderly people have sensitive or dry skin, so harsh soaps or cleansers that strip away natural oils can worsen dryness and cause irritation. Doctors recommend using gentle fragrance-free cleansers formulated specifically for sensitive or mature skin. These products clean effectively without disrupting the skin's natural moisture barrier when washing the face. Seniors should use lukewarm water rather than hot water, which can dry out the skin. Using a soft washcloth or simply the hands, they should gently cleanse the face without scrubbing vigorously to avoid damaging the delicate skin. After cleansing, it's important to pat the skin dry with a soft towel instead of rubbing it. Hydration is another critical aspect following cleansing. Applying a good moisturizer helps lock in moisture and protects the skin from becoming dry and flaky. Many moisturizers designed for elderly skin contain ingredients like hyaluronic acid or ceramides that help restore the skin's natural barrier. Regular facial cleansing also offers an opportunity for seniors or their caregivers to inspect the skin for any unusual changes such as new moles, redness, or sores that do not heal. Early detection of skin issues, including skin cancer, can be life-saving. In summary, daily face washing is a simple yet vital step in elderly personal hygiene. It removes harmful dirt and oils, prevents infections, maintains skin health, and supports overall well-being. By adopting a gentle and consistent facial cleansing routine with appropriate products, seniors can protect their delicate skin and enjoy a healthier, more comfortable life. Hand hygiene is one of the most effective ways to prevent the spread of infections, especially for seniors over 70, whose immune systems tend to weaken with age. Frequent hand washing removes germs, bacteria, and viruses that can cause illnesses ranging from the common cold to serious infections like pneumonia or COVID-19. For elderly individuals, who are more vulnerable to complications from infections, maintaining clean hands is essential to stay healthy and avoid hospitalizations. Hands come into contact with countless surfaces throughout the day: door handles, railings, phones, and more, making them a common vehicle for transmitting germs. When seniors touch their face, eat, or care for wounds with unclean hands, pathogens can easily enter the body, leading to infections. This is why doctors strongly emphasize washing hands thoroughly and regularly, especially before eating, after using the bathroom, or after coming back from outside. Effective hand washing involves using soap and clean water, scrubbing all surfaces of the hands, including between fingers, under nails, and the backs of hands, for at least 20 seconds. This duration is important because it allows the soap to break down oils and dirt that trap germs, ensuring they are washed away properly. Rinsing hands well under running water removes the loosened debris and microbes. For seniors with arthritis or limited hand mobility, hand washing can sometimes be challenging. In such cases, using liquid soap dispensers, installing levis faucets, or using hand sanitizers with at least 60% alcohol can be helpful alternatives. However, it's important to note that hand sanitizers do not eliminate all types of germs, such as certain parasites or spores, so washing with soap and water remains the best option when available. Keeping nails short and clean is another important aspect of hand hygiene for older adults. Dirt and germs can accumulate under long or untrimmed nails, increasing the risk of infections. Regular nail care can prevent this and make hand washing more effective. In addition to preventing infectious diseases, Clean hands can also reduce skin problems common in seniors, such as dermatitis or fungal infections, which can start from contaminated hands touching sensitive areas of the skin. Caregivers and family members should encourage and assist elderly individuals in maintaining good hand hygiene habits. This can include reminding them to wash their hands, helping with nail care, or providing easy access to hand washing stations and supplies. Foot hygiene is often overlooked, especially among seniors, but it is a crucial part of overall health and comfort, particularly for those aged 70 and above. Proper cleaning of the feet daily is essential to prevent fungal infections, unpleasant odors, and other complications that can impact mobility and quality of life. As we age, the skin on the feet becomes thinner and drier, reducing its ability to protect against infections. Seniors are also more prone to conditions like diabetes and poor circulation, which can impair the body's natural defenses and healing processes. These factors make it vital to maintain good foot hygiene to avoid problems such as athlete's foot, fungal nail infections, and bacterial infections. Feet tend to sweat, and when moisture is trapped inside shoes or socks, it creates an ideal environment for fungi and bacteria to thrive. This can lead to itchy, scaly skin, redness, and cracking, which can be painful and increase the risk of secondary infections. Additionally, fungal infections often cause unpleasant odors that can be embarrassing and uncomfortable. Daily washing of the feet with warm water and mild soap helps remove sweat, dirt, and germs that accumulate throughout the day. It's important to clean all areas carefully, including between the toes where moisture often collects unnoticed. After washing, drying the feet thoroughly is crucial because damp skin promotes fungal growth. Special attention should be paid to drying between the toes with a soft towel or cloth. Moisturizing the feet after drying is also beneficial to prevent dryness and cracking, which are common in older adults. However, it's important to avoid applying moisturizer between the toes, as excess moisture there can increase the risk of fungal infections. Socks and footwear play a big role in foot health. Seniors should wear clean, breathable socks made of natural fibers like cotton or wool, which help wick moisture away from the skin. Shoes should fit well, allow ventilation, and be kept clean and dry. Changing socks daily and alternating shoes to give them time to air out can greatly reduce moisture buildup. Regular foot inspections are vital, especially for seniors with diabetes or circulation problems. Checking for cuts, blisters, redness, swelling, or changes in skin color can help catch issues early, before they worsen. If any signs of infection or wounds are found, it's important to seek medical advice promptly. For seniors who have difficulty bending or reaching their feet, caregivers can assist with washing, drying, and inspection to ensure proper foot care. Routine visits to a podiatrist are also recommended to maintain foot health, trim nails safely, and address any foot problems. In summary, thorough daily cleaning of the feet is a simple yet critical practice for seniors to prevent fungal infections, bad odors, and skin complications. Good foot hygiene supports mobility, comfort, and overall well-being, helping elderly individuals stay active and pain-free. The underarm area, or armpits, is a prime spot for sweat and bacteria accumulation, which can cause unpleasant odors, skin irritation, and infections if not cleaned properly. For seniors, especially those over 70, maintaining good hygiene in this area is crucial for comfort, confidence, and overall health. The skin in the underarm area tends to be sensitive and prone to irritation because it is frequently moist and experiences friction. Sweat glands in this region produce moisture that, when combined with bacteria naturally present on the skin, can lead to the production of body odor. This process is natural but can become more noticeable and uncomfortable in older adults due to changes in skin texture, hormone levels, and decreased immune response. Daily washing of the underarms is essential to remove sweat, bacteria, dead skin cells, and deodorant residues. Using gentle fragrance-free soap and lukewarm water is recommended to avoid irritation. Vigorous scrubbing should be avoided since it can damage delicate skin and cause inflammation. After cleansing, thoroughly drying the underarms is equally important. Moisture left in this area can foster bacterial and fungal growth, leading to infections such as intertrigal, a rash caused by skin rubbing and moisture or fungal overgrowth. Using a soft towel to pat the skin dry or allowing air drying before dressing can help prevent these issues. Many seniors experience excessive sweating, hyperhidrosis, or changes in sweat composition, which can increase the intensity of body odor. Wearing clean, breathable clothing made of natural fibers like cotton helps wick away moisture. Maintaining proper hygiene of the genital area is especially important for seniors, particularly those over 70, because the skin and tissues in this region become more sensitive and prone to infections as we age. Daily cleaning of the genital area is essential to prevent discomfort, unpleasant odors, and infections that can impact overall health and quality of life. The genital area is warm and moist, which makes it a natural breeding ground for bacteria and fungi if not kept clean and dry. In elderly individuals, changes in hormone levels, reduced immune function, and conditions such as incontinence or diabetes can increase the risk of infections like yeast infections, urinary tract infections, UTIs, and bacterial vaginitis. These infections can cause itching, redness, swelling, and pain, and if left untreated, may lead to more serious health complications. For women, postmenopausal changes result in thinning and drying of vaginal tissues, making them more vulnerable to irritation and infection. Gentle daily cleansing with mild, fragrance-free soap and warm water helps remove sweat, urine residue, and bacteria without causing further dryness or irritation. It's important to clean only the external genital area vulva and avoid douching or using harsh soaps internally, as this can disrupt the natural balance of bacteria and lead to infections. Men also need to maintain daily hygiene of the genital area, paying special attention to cleaning beneath the foreskin if uncircumcised. This helps prevent the buildup of smegma, combination of dead skin cells and oils, that can cause unpleasant odors and increase infection risk. Gentle washing with mild soap and water, followed by thorough drying, is recommended. Incontinence, which is common among older adults, can complicate genital hygiene. Frequent exposure to urine or feces can cause skin irritation, rashes, and increase infection risk. Seniors using adult diapers or pads should change them regularly and clean the genital area thoroughly each time to prevent these problems. Using barrier creams can also protect the skin from moisture-related damage. Drying the genital area carefully after washing is crucial because moisture encourages fungal and bacterial growth. Using a soft towel and patting gently rather than rubbing helps protect delicate skin. Wearing breathable cotton underwear and loose-fitting clothing allows air circulation and reduces moisture buildup. Regular genital hygiene is not only important for physical health but also for mental and emotional well-being. Seniors who maintain good hygiene feel more comfortable, confident, and free from embarrassment related to odors or irritation. Caregivers can assist elderly individuals who have difficulty with personal care, ensuring the genital area is cleaned properly and gently. If any signs of infection such as unusual discharge, redness, swelling, or persistent itching appear, it is important to consult a healthcare professional promptly. In summary, daily cleaning of the genital area is a vital hygiene practice for seniors. It prevents infections, promotes comfort, and supports overall health. Using gentle, appropriate cleansing methods and maintaining dryness can help elderly individuals stay healthy and comfortable in this sensitive area. Ear hygiene is an often overlooked aspect of senior health, but is vital, especially for those over 70, to prevent discomfort, hearing problems, and infections. Proper cleaning of the ears helps avoid wax buildup, which can impair hearing and cause irritation or infections if neglected. Earwax, medically known as suramin, is a natural substance produced by glands in the ear canal. It serves an important protective function by trapping dust, debris, and microorganisms, preventing them from reaching deeper parts of the ear. Normally, earwax naturally moves out of the ear canal, where it can be washed away during bathing. However, as people age, this self-cleaning mechanism may slow down, and earwax can accumulate excessively. Excessive wax buildup can block the ear canal, causing hearing loss, a feeling of fullness or pressure in the ear, ringing tinnitus, itching, or even pain. In some cases, impacted wax can cause infections by trapping moisture and bacteria inside the ear canal. Seniors are particularly vulnerable because age-related hearing loss can make it difficult to notice the added effect of wax buildup. Regular ear cleaning is essential to prevent these problems, but it must be done carefully to avoid damaging the delicate structures inside the ear. Doctors recommend cleaning only the outer ear with a soft cloth or tissue. Inserting cotton swabs or other objects deep into the ear canal is discouraged because it can push wax further in, cause injury, or lead to infections. For seniors experiencing symptoms of earwax buildup or discomfort, professional ear cleaning by a healthcare provider or audiologist is advised. They can safely remove impacted wax using specialized tools or gentle irrigation techniques. Home remedies such as eardrops containing mineral oil or hydrogen peroxide may also help soften wax for easier removal, but these should be used cautiously and under medical guidance. In addition to wax buildup, seniors should be aware of signs of ear infections, such as pain, discharge, swelling, or sudden hearing loss. Age-related changes in immune function can increase susceptibility to infections, which require prompt medical treatment to prevent complications. Maintaining dry ears is also important because moisture trapped in the ear canal can promote fungal or bacterial infections. After bathing or swimming, gently drying the outer ear with a towel and tilting the head to drain water can help prevent moisture buildup. Regular hearing checkups are recommended for seniors to monitor hearing health and address any issues early. Good ear hygiene combined with professional care can significantly improve quality of life by preserving hearing ability and preventing infections. In summary, regularly cleaning the ears safely and monitoring for signs of wax buildup or infection is crucial for seniors. Proper ear care prevents discomfort, hearing problems, and infections, supporting overall health and well-being in elderly individuals. As people age, their skin undergoes natural changes that make it more prone to dryness, thinning, and cracking. For seniors, especially those over 70, maintaining proper skin hydration is crucial to prevent discomfort, infections, and other complications. One of the most effective ways to protect aging skin is to apply moisturizer immediately after washing. The skin's outer layer, called the epidermis, contains natural oils and lipids that lock in moisture and protect against environmental irritants. Over time, the production of these oils decreases, causing the skin to lose its ability to retain moisture. Additionally, reduced sweat gland activity and slower cell renewal contribute to dryness. This is why elderly skin often feels rough, flaky, or tight, especially after washing with water and soap, which can strip away natural oils. Dry, cracked skin is not only uncomfortable but can also create entry points for bacteria and fungi, increasing the risk of infections. Conditions like eczema or dermatitis are more common in seniors with dry skin. Moreover, cracked skin on hands or feet can lead to painful wounds and delay healing due to impaired circulation in older adults. Moisturizing after washing helps replenish lost hydration and restores the skin's protective barrier. Applying moisturizer on slightly damp skin is most effective because it traps water in the skin, preventing evaporation. Seniors should choose moisturizers that are rich yet gentle, preferably fragrance-free, and designed for sensitive or mature skin. Ingredients like glycerin, hyaluronic acid, ceramides, and natural oils such as jojoba or almond oil are beneficial because they attract and hold moisture while repairing the skin barrier. Creams and ointments tend to be more effective for very dry skin than lotions, as they provide a thicker protective layer. It's important for seniors to moisturize all parts of the body regularly, paying special attention to areas prone to dryness like hands, feet, elbows, and lower legs. For the face, using a light but hydrating facial cream can help maintain softness without clogging pores. Seniors with mobility issues or arthritis may find it difficult to apply moisturizer evenly. In such cases, caregivers can assist with the application to ensure thorough coverage and prevent skin breakdown. In addition to moisturizing, seniors should avoid long, hot showers or baths, which can further dry out the skin. Using mild, soap-free cleansers instead of harsh soaps can also help preserve natural oils. Drinking plenty of water and maintaining a balanced diet rich in vitamins and fatty acids supports skin health from within. In summary, moisturizing after washing is a vital step in senior skincare. It prevents dryness, cracking, and related complications by restoring hydration and strengthening the skin's barrier. Consistent moisturizing keeps the skin comfortable, resilient, and healthy, enhancing overall well-being in elderly individuals. We age, the skin becomes thinner, more delicate, and prone to dryness and irritation. For seniors, especially those over 70, Choosing the right cleanser is a critical part of daily hygiene to protect the skin's natural barrier and maintain its health. Using gentle, senior-friendly cleansers tailored to sensitive aging skin helps prevent irritation, dryness, and other skin problems. Aging skin loses its ability to retain moisture and is more susceptible to damage from harsh chemicals found in many soaps and cleansers. Traditional soaps often contain detergents and fragrances that can strip away natural oils, leading to dryness, redness, and itching. This can exacerbate common issues in elderly skin such as eczema, dermatitis,